Good morning again. That was a very interesting and important presentation that saves a lot of time of my, this is the classification that Dr. Elmore showed that we haven't progressed much. And actually, after I published this in the book, I realized that this was discovered in or written in Germany since 1890. I will not go through these different scores, which we all know, and they are very valuable. Dr. Elmore already described this, which is very important, so I would save time about this. And I'll just go through this. This is actually a sort of an attempt to make the GMS score easier. And instead of going to 12, we make it into 10. And this was discussed among the scientific committee before the Frankfurt meeting, and this is what we came up to. But if you look at what Dr. Elmore described as 10, 11, 12, you'll find that it is all coming into this category. Perineal hypospadias, which by definition as a syndromic feature have severe chordee. By definition, they have small glands, and by definition, they would have a hypoplastic urethral plate. So to be honest, although we developed this together as a group of, or modified this, not developed, to be more accurate, as a group of 6 from the GMS score, and we tried to make it into 10, you will find what Dr. Moore described as the group who have high complication. They are actually, in fact, grade 4 perineal hypospadias where you need to divide the urethral plate. The other 3, you don't need to divide the urethral plate. So for example, if you have a patient with penoscrotal or midpenile hypospadias, and you have severe chordee, and you have to divide the urethral plate, which should automatically go into grade 4. Otherwise, you do not need to divide the urethral plate, and you will have this. We reviewed in the Hypospadias Center our data during the past 10 years, and this is actually what I use with my patients in my praxis. I tell the patient, depending on the meatus, I would divide it into grade 1, 2, 3, and 4. And by grade 4, by definition, I would need to divide the urethral plate. And they would know that this child would eventually have the urethroplasty in the second operation, and this will be assessed when I deal with the foreskin in the third operation. However, this group 3, which group 4 would be in Dr. Elmore already, between 10 and 12. And probably group 3 is the group where you may and you may not decide to divide the urethral plate, and this is a decision made intraoperatively. And I tell the parents, if I find the chordee is severe, I would have to divide it, the urethral plate. It will be managed as a grade 4. So, and this is what I tell them. The operation takes about 1 hour in grade 1 and 2, 2 hours in grade 3, 2 hours in 2 operations in grade 4. Complications in 1 year. This is what I have in my personal series. This complications rate double if you follow the patients for more than 10 years. So instead of distal, I have 5% complication. It becomes 10 in 10 years follow-up. There are other 2 points which Dr. Elmore alluded to. This is actually a more detailed preoperative assessment. It's very nice, it's very conclusive, but it's not easy to convince people to follow. I remember I was discussing this with Peter Kokau before the Frankfurt meeting, and he said, Ahmed, there are 2 ways. Make it simple that people would follow it, or make it complicated like what we do in Great Ormond Street. We tried to make it as simple as possible, and as I said, what I use in my practice is simply grade 1, 2, 3, 4, and you will find automatically grade 4. It's very unlikely that you have a very small glands with a well-developed penile shaft. They all come together as one package. There is more about hypospadias checklist, which is very complicated. I think we'll leave the operative and post-operative probably to discuss in Vienna. Thank you very much.